There's a lot of awareness today about mental health. But have you ever stopped to think, well, what exactly is mental health anyway? I bet if I asked you to define mental illness, you could probably come up with a definition or at least examples of it pretty quickly. But if I were to then say, okay, well, what's the opposite? What is mental health? That might be a little bit harder to define, but it's important to define it because we need to know if we're working on our mental health, what's the goal? What exactly are we working toward? So, in this video, I'm going to explain mental health by comparing and contrasting it with mental illness. So, let's get into it. Hi, I'm Dr. Lori Barker, and I'm a therapist, educator, and consultant, and I love teaching people tips for how to improve their mental health and start living their best lives. So, the first thing that we need to understand is that mental health and mental illness are not mutually exclusive, meaning there's no black and white, clear cut line to say that you fall on one side or the other. It's more helpful to think about them as occurring along a continuum with mental health on one side and mental illness on the other. And most of the time, we function somewhere in between, right? We all have those days where maybe we're leaning a little towards the more towards the mental illness side where we don't feel so great, right? We all have those days where we're feeling a little more down or we're feeling a little more anxious or sad. And then there's the other side, and we all go through phases, hopefully, where we're more towards the mental health side, where we're feeling good, we're feeling great, we're motivated, we're feeling joy and happiness. But most of the time, we function somewhere in between those two, and that's healthy. But how do we define it? Still helpful to define sort of those two extremes, what's on the mental illness side and what's on the mental health side. So that's what we're going to do. Start by defining those extremes and help you understand where does it start to become a problem, like if you're getting too close to the mental illness side. So, one of the first ways of understanding mental illness is through something we call subjective distress. That just means if I were to ask you right now, how are you feeling? And you tell me, oh, well, I'm not feeling so great, or I'm feeling kind of anxious, kind of depressed, then we would say that's your subjective distress. I mean, it's your own personal report about how you are feeling or how you are doing. So if you're saying, I'm not so great, I'm not doing so well, I've got some symptoms, then you would fall closer towards the mental illness side of the continuum. But if I ask you how you're doing and you're like, hey, I feel pretty good, I'm feeling strong, I'm feeling motivated, all of those things, then you would be closer towards the mental health side. And we would call that subjective well being. Another criterion that we use to determine mental health versus mental illness is functionality. That simply means your ability to do your daily activities. How easy is it for you to get to work and to complete your responsibilities at work? How easy is it for you to go to school and complete all your assignments for school or to get along with other people? How easy is it for you to get out of bed and get a shower and brush your teeth and get dressed? If you are easily able to do all of those things, we call that, that's your ability to function on a daily basis. That puts you more towards the mental health side. But if you're having trouble with any one of those things, if they're really difficult for you to do, then that would put you more toward the mental illness side. In talking about functionality this time, I actually mentioned another criterion that we use to differentiate between mental health and mental illness, and that has to do with relationships. So, if you are able to maintain healthy relationships, meaning you're able to make friends, keep friends, you're able to communicate effectively, you are able to resolve conflicts with other people, you're able to make plans with other people, hold conversations, these are all signs of mental health, that you are able to maintain healthy relationships. On the other hand, if you are frequently arguing with people, getting into conflicts with people, you're often losing friends or losing relationships, those could be some signs that you are moving closer toward the mental illness side of that continuum. Another way we talk about these two things is to determine if someone's in touch with reality or out of touch with reality. Are they seeing and hearing and feeling the same things that we are? Are they interpreting the things that go around them the way most other people would? If they're not, then they may be out of touch with reality. Versus if you make accurate interpretations about what's going on around you, if you are accurately able to perceive things through your five senses, accurately talking about what you see, what you hear, feel, taste, then you are in touch with reality, and that would put you more toward the mental health side. We also look at development. Some of you may have taken a class in developmental psychology, but we understand the concept of developmental milestones, meaning when you're born and as you grow throughout the years, your pediatrician will, whenever you come in for your checkup, will look to see if you're meeting developmental milestones within what we consider a normal age range. For example, we expect most children, the age range that kids begin to talk is somewhere around 1 years old. It's about the same for walking. Kids tend to learn how to walk around the age of 1. These are, again, the transitions in life that we look for, that people are supposed to have certain skills and abilities. And if they are not developing those skills and abilities that we would expect them to by a certain age, then that is a sign that there could be a problem. Another thing that we look at are cognitive abilities. Most of the time, we associate cognitive abilities with schoolwork, right? So if you're able to learn things in school, like how to read or how to do math or how to understand language, these are cognitive abilities, ways that your brain processes information. So, your ability to memorize things, to categorize, to problem solve, all of these are cognitive skills. And if someone's not able to do those things, that could be a sign that there's a problem. Many of you have probably heard about learning disabilities. Many of you probably have a learning disability. And maybe that has hindered you or challenged you in your ability to be successful at school or in other places like work. So that's when we call it, if we put it on the disability side, then we're more toward the illness side. And if you're able to do all of those things effectively, then we put you closer to the healthy side. We also look at someone's ability to make and achieve goals. Many of you are either in school or you've been through school, so that shows your ability to set a goal. Hey, I want to go to college and I want to get my bachelor's degree, or I want to get into a certain career, and you figure out what the steps are to get to that career. And you can plan and you can work your way through those steps all the way until you successfully meet that goal. If you are able to do that, that is a sign of mental health. If you're unable to do that, if you continue to set goals and are not able to achieve them, you have a lot of problems, a lot of challenges along the way to trying to achieve those goals, that could be a sign that you need some help, right? That there is an issue and you could benefit from some help. Another thing that we look at in terms of behavior is constructive behavior versus destructive behavior. Do you continually get into situations where maybe you've heard that term self sabotage? Maybe you're sabotaging yourself, or maybe you're doing things that harm yourself, harm other people. Again, if you're engaging in those kinds of things, then we would put you closer to the mental illness side. Versus if you're not doing those things, right? If you're able to engage in constructive behaviors like things that we just talked about, such as setting goals, having positive relationships, all those things we talked about already are constructive things. If you're able to do that, then you are closer to the mental health side. And I also want to talk about the mental health side. Mental health doesn't necessarily mean I'm just happy and giddy and joyous all the time. In fact, for people to say, oh, mental health means I'm happy all the time, that is not true. That is not accurate. Happiness is actually an emotion that comes and goes. It's not something that can be maintained all the time. So it's natural to have sort of normal mood fluctuations from day to day or even throughout the day. Again, you need to pay attention to knowing when those become problematic. But happiness, it's impossible to feel happy all the time. It's really more achievable, I think more realistic to say what you're trying to achieve is peace, or what you're trying to achieve is contentment, so that no matter what is going on, you still sort of have this core or this center that's grounded and content and at peace. That is a more realistic goal than saying, I'm just going to be happy all the time, right? So it's okay to once in a while have some negative emotions. That's just part of life. That's part of being human, that we are going to experience negative emotions. And part of being mentally healthy is how we handle those more negative emotions. So it's not so much that we have them, it's how do we cope with them? How do we express them? How do we handle them? And how do you know when it's become a problem and you've crossed over into it being a significant issue where maybe you need some help? Well, I have a video all about that, so be sure to go to my channel and check that one out, where it's about how do I know if I need to seek help, right? So I go over the criteria for how to do that. For example, if it's something that is causing you a lot of distress, if it is interfering with your ability to function, if it is interfering with your ability to have healthy relationships, those are just some examples to know when you've crossed that line where maybe you need some extra help to help move you back closer to the mental health side. So I hope that this conversation about mental health versus mental illness has been helpful, and mostly for you to really start thinking about what does it mean to be mentally healthy. So if we say, which is very common right now for people to say, I'm focusing on my mental health, or I'm taking a mental health day, or I'm not having a good mental health day, to understand what we really mean when we say that, and to understand what we're working toward. And that's a goal, right? And that's what I'm here for. This is what I want to help people do. I want to help people work toward that goal of improving their mental health and being able to live their best lives. Leave me a comment below. I'd love to hear from you. Thank you so much for watching. Be sure to visit my channel and subscribe, and I'll see you in the next video.